gonna go ahead and read your medical history a little bit. I do remember you from last time, that's for sure. So you have no major illnesses recorded. Now go ahead and tell me what's going on today. Why are you here? Okay. Oh, tough luck, yeah. I'm so sorry about your accident. I'm glad it wasn't very serious, but I'm gonna go ahead and give you a check. Okay. And did you go to the hospital after your accident? So no hospitalizations. You did have an injury about 2 weeks ago, and you did hurt your head really bad. Can you please show me where it was? Great. I'm gonna go ahead and note that. Do you have the same allergies? Perfect. Okay. Let's go ahead and begin our examination. Are you experiencing any tingling sensation down your arms or your back or in your feet? No. Good. Are you having any pain right now? Okay. On a scale of 0 to 10, how would you rate your pain? Okay. And can you please tell me today's date? Okay. Who's the President of the United States? Okay. Can you please tell me what's 4 plus 2 minus 3? Okay. Great. So you're alert and oriented. That's perfect. Can you please tell me exactly where we are right now? Exactly. So you're alert and oriented times 3. That's very good, very reassuring. Let's go ahead and listen to your heart and your lungs really quick. Okay, I'm going to put this on your chest and I'm going to ask you to uncross your legs, if that's okay. Perfect. Also, can you please breathe normal while I'm listening to your heart? Great. So go ahead and relax. Is it okay if I put my stethoscope underneath your shirt? It's okay. Good. So go ahead and relax. And I'm just going to go ahead and check your heart. Okay. Just gonna go ahead and move the stethoscope left and right on your chest. Good. Okay. I was not able to hear any extra sounds, only S1 and S2, no S3, no S4. Now I'm gonna go ahead and listen for any murmurs, which I do that with the bell. I just switch the stethoscope to this side, and I'm going to put it on your chest again. Is that okay? Okay. Okay. Can you please hold your breath for 3 seconds? Good. 1, 2, 3. And breathe out. Okay. I'm going to ask you to that again. I need to listen. Take a deep breath in and hold it for 1, 2, 3. Great. I was not able to hear any murmurs, so that's really good. Let's go ahead and check your lungs. Good. Take a deep breath in, okay? And breathe out. Good. And I'll check on the other side as well. Take a deep breath in and breathe out. Okay. And I'll put it on your chest. So please relax. Take a deep breath in and relax. Good. Take a deep breath in and breathe out. Okay. I'm gonna go ahead and check your neck for any lymph node enlargement. Can you please lift your chin up a little bit so I can have better exposure to your neck? Good. And your trachea. Good. And now I'm gonna go ahead and check above the clavicles. Let me know if you feel any kind of pain. Okay, wonderful. Go ahead and give me a big smile, please. Good. And now frown and puff your cheeks just like I do. Keep them puffed for me, please. Don't let me unpuff them. Wonderful. Can you please push with your tongue inside your cheek? And now do the same thing on the other side. Okay. Stick your tongue out. Good. Now go ahead and move it up and down. Good. Left and right. Great. Go ahead and relax your jaw. I'm going to tap your jaw. Make sure that I'm eliciting the right neurological response. Excellent. Can you please close your eyes and hold them closed? I'm going to try to open them. Don't let me do that. Great. And now lift your eyebrows up just like this. Good. I'm going to try to push them down. Don't let me do that. Keep on lifting them up. Great. Okay. Now I'm going to ask you to move your jaw side to side just like this. Do you hear any clicking sounds when you do that? You do. Okay. Go ahead and open your jaw for me, please. Like this. Okay. Good. Keep on doing that. Open and close your jaw. Open and close. Open and close. Okay. So I do hear some clicking in your jaw, which is right here in the temporomandibular joint. I'm afraid that you might suffer from a dysfunction called temporomandibular joint dysfunction, which really gives you a lot of pain in this area. So I think your pain is not due to the accident, it's actually due to this disorder. Now, why you developed it, I'm not sure, but if we continue with this cranial nerve examination, then for sure we're going to find out what is the cause. This is what I really like to do with my patients. I like to find the cause of what you're suffering from. Even though I'm putting a label on your disorder, I want to find out why. So it's very important, because once you know why this is happening to you, then we definitely know how to treat the disorder from the root cause and just get rid of it, instead of just treating the symptoms. Okay, now I'm gonna go ahead and just check your face. Give me a second. What I'm gonna do is I'm going to elicit neurological responses, and I'm going to tap on your bony prominences, right? Okay, so go ahead and close your eyes and relax for me, please. Did you feel that? Okay. Did you feel that? Did you feel that equally on both sides? Okay. Now I'm gonna go ahead and tap on your cheeks, and it's right here on the bony parts, okay? So go ahead and relax. Did you feel that? Good. Did you feel that? Okay. Did you feel that equally on both sides? Good. And now I'll do the same thing again on the jaw. Relax. Good. Relax again. Good. And now I'm gonna go ahead and go right here in the back. You see where I'm pointing? Okay, that's where I'm going to tap. Now tell me if you feel any pain, any tingling sensation down your jaw. Good. Great. All right. Now, let's go ahead and check your muscles and make sure that the coordination is working properly. I'm going to ask you to look to your right, which is that way. Okay. So go ahead and look that way, and I'm going to try to push you the opposite way. So you're going to have to resist my hand pushing your jaw or pushing your face. Does that sound okay? So go ahead and look that way, and I'm going to try to push you the opposite way. Okay, go ahead and do that. Okay, so I got the right response. Now let's go ahead and switch sides. So I'm going to push you this way, okay? And you're gonna have to look that way. Wonderful. So I got the right response there too. Now I'm going to go ahead and ask you to shrug your shoulders. Okay? And I'm going to push down on your shoulders. Don't let me do that. Good. All right, I got the right response there too. Now I'm going to ask you to look down, all the way down, and touch your chin with your chest. Okay? So try to do this. And tell me if you feel any kind of pain down your spine. Even down. No. Now go ahead and do the same thing and look all the way up and tell me if you feel any kind of electrical pain down your spine. No. Wonderful. Okay. In that case, I'm going to go ahead and check your mouth. Can you please move your tongue? Okay. Good. And stick your tongue out for me, please. Alright, so tongue is midline. Uvula is also midline. I'm not noticing any enlarged lymph nodes. No adenopathy. Okay. Go ahead and close your mouth. Alright, I'm going to go ahead and check your oxygenation next. Can you please stick your index like this for me? Excellent. And take a deep breath in. And relax. Okay. Wonderful. Your heart rate is 97. It's a little bit on the high end, but I'm not very concerned. And your oxygenation is 97 percentile on room air. Wonderful. Okay, let's go ahead and check your eyes and your pupil dilation now. Can you please look at my nose? And keep on looking at my nose, okay? Good. Keep on looking at my nose. Alright. And now I'm going to press down on your eyelid. Good. And on the other side. Excellent. Can you please follow the light with your eyes only? Don't move your head at all, okay? Good. Good, 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 good. Excellent. Okay. Okay, so I'm not noticing any abnormalities here. Your eyes are able to move in all directions, so you can move them up, down, and also come in the middle. Now go ahead and look right here at the light. I'm going to bring the pen light very close to your nose. I'm going to need you to focus on the light, okay? Keep on focusing on the light. And I'm going to bring it very close to your nose. Good. I'm going to do that again. Now, please focus on the light again. Good. 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 Keep on looking at the light. Excellent. All right. I'm gonna go ahead and check your smell. Okay. All right. So before I do that, I'm gonna need to make sure that your nose is patent. What does patent mean? It means that there's nothing obstructed in your nose and that you can breathe in and breathe out through your nose. For me to do that, I'm just going to go ahead and ask you to cover one nostril, one nose, okay? And breathe in, breathe out through your nose. Good. So that's patent. Now let's go ahead and check the other side. Same thing. Breathe in, breathe out through your nose. Wonderful. So that tells me that there's no obstruction. You can definitely and your canal is open. There's nothing obstructing, so you can breathe through your nose. Now if you can actually distinguish this smell, that's a different story. This is where your cranial nerve 3 gets involved. Okay, so go ahead and cover one nostril. This is very important. And take a deep breath in through the open nostril. Good. And now, can you please tell me what this smells like? Perfect. Okay. I'm gonna go ahead and check your facial sensation. This test is called sharp or dull. Okay, so I'm gonna ask you to extend your palm. Thank you. And this is what dull feels like. Wonderful. And now I'm gonna go ahead and show you what sharp will feel like on your face. Okay, now of course I will not do it so sharp so it will not hurt you in any way. Okay, go ahead and close your eyes. I'm gonna need you to tell me if it's sharp or dull. Dull. What about now? Close your eyes. Sharp. Okay, what about now? Dull. What about now? Dull. And now? Sharp. And now? Dull. What about now? Sharp. Excellent. I'm going to go ahead and advance this test. Make sure that I'm not missing any facial sensation errors. Let's go ahead and discuss what this involves. Okay, now this might feel a little bit cold, so I'm gonna go ahead and touch you with it. Go ahead and extend your palm. I want you to know what it will feel like. Good. And then this is what will feel sharp. Okay, so I'm gonna need you to tell me if it's sharp or cold. All right, go ahead and close your eyes. Sharp. Sharp. Cold. Sharp. 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 Cold. 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 Excellent. Okay, I'm gonna go ahead and check your ears, make sure that there's nothing stuck in the auditory canal. All right, so please look that way for me. I'm going to look into this ear first. Okay. Ear canal is clean. I'm not noticing any signs of infection. Tympanic membrane is pearl gray, which is perfect. Margins are well defined, and I'm not seeing any fluid behind the ear. Excellent. I was not able to see any cerebrospinal fluid, so I'm not concerned about any meninges, leaking into the back of your head. Now, I'm gonna go ahead and check your other ear. Let me know if you experience any kind of pain. Okay. I'm not noticing any abnormalities here. Tympanic membrane is also pearl gray. Good. Alright. No signs of infection, and also I was not able to notice any CSF fluid, so that's great. Okay. Go ahead and close your eyes. Can you please tell me with which ear you hear this sound? Perfect. What about now? Wonderful. Now go ahead and tell me how many times you hear this sound. Good. And now? Wonderful. Can you please tell me with which ear you hear this sound? Excellent. I'm gonna go ahead and whisper some words in your ears. Can you please repeat them back to me? Mad, B, ASMR. Wonderful. I want my tingles back from you. Excellent. So you can hear with both ears. I'm very happy about that. Okay, now go ahead and tell me with which ear you feel this. Okay, I'm going to touch you on different parts of your ear. I'm going to need you to tell me on which ear you feel. Go ahead and close your eyes. Okay, wonderful. Keep your eyes closed and tell me on which ear you feel this. Excellent. Okay. I'm going to go ahead and check your optic nerve. For this, I'm going to need you to look behind me at the wall. Okay, so I'm going to go ahead and take a look in this eye first. Alright, I'm going to flash a light in your eyes. It's going to be just for a second. I need you to keep your eyes open, okay? Go ahead and relax. Okay. Your optic nerve is intact on the right side. Alright. Now go ahead and keep on looking behind me. Optic nerve is intact. I'm not seeing any scratches. Okay, no redness. Excellent. Alright, let's go ahead and check your temperature. Can you please relax? I'm going to put this on your forehead. Wonderful. Alright, 99.1. It's not elevated. I'm not concerned. Okay. Now I do have to check taste as well. It is part of the protocol. So what I'm going to do is I'm going to put just a drop on your tongue. Don't worry, the drop will be very concentrated, so you'll definitely be able to distinguish the taste. The taste is a very basic one. Most of the people do recognize it unless there is something wrong with your cranial nerve 8. Okay, so I'm just going to go ahead and put one drop. And can you please tell me what that tastes like? Perfect. Okay, let's go ahead and try one more. Okay, so what I'm going to do is I'm going to take one drop, just have to make sure that I mix it really well. Okay, and I'm going to place one drop on your tongue. I'm gonna ask you to open your mouth. Excellent. Now go ahead and tell me what that tastes like. Perfect. It is algae. Okay. Okay. Let's go ahead and check your smell again. I'm going to ask you to breathe in, breathe out with both ears. Wonderful. Yes, it is indeed lavender. Okay. Let's go ahead and check your blood pressure. Now, have you ever been told by a practitioner that you have hypertension? Not that you know of. And are you experiencing headaches frequently? No. And when you do experience them, if you take Tylenol or ibuprofen, does it go away? It does. Then that's very reassuring. Let's go ahead and check your blood pressure. Do you have an arm preference? And have you ever been told that you had an embolism? No. Okay. So let's go ahead and try this arm. Wonderful. And I'm going to go ahead and put my stethoscope on. Good. Can you please uncross your legs? Great. Okay. All right. Now please relax for me. Okay. Your blood pressure is 122/65. A little bit on the low side, the diastolic, but I'm not very concerned. Yeah, because I'm always looking at the trend to see how you've had it in the past, and that's where you usually are, so that's why I'm not concerned. Okay, part of a cranial nerve exam is to make sure that you're not experiencing any color deficiency. So what I'm going to ask you to do is to tell me what number you see right here. You don't see any. Okay. What about here? No. All right. Okay. Now this one is very easy. I'm going to ask you to take my index finger and I'm going to ask you to take me from this X. Do you see it? Okay. All the way to this X. Can you do that? All right. So here's my index finger. Go ahead and trace. Good. Alright, you did great. Okay. Can you please tell me what number you see here? 35. Excellent. Okay. I'm just gonna go ahead and write the findings and make sure that we do have proper documentation of what happened today. Right, your blood pressure was within normal limits, so that's very good, and all other vital signs were normal. Okay, not complaining of any headaches, no paralysis, no numbness, no tingling. Your pupils are equal, round, and reactive to light, so that's excellent. And you haven't experienced any seizures either, right? Okay. No chest pains, no asthma, lungs are clear, no nausea, no vomiting, correct? Okay. Okay. Skin also looked intact, and your facial sensation is also intact. Now, I was not able to see any abnormalities with your all 12 cranial nerves. So what I'm going to guess is that what you're experiencing, that clicking sound in your jaw, it's based on stress and anxiety. It is very common to be triggered by that. Now, if you do suffer from lots of stress, lots of anxiety, and maybe you're in the bump of jumping into depression, we do have other healthcare providers available for you in this clinic. Yes, I only perform cranial nerves. So, for that, I'm gonna have you go to my next colleague. Is that okay? All right, I'm going to give her your chart and I'm going to let her know about what's going on. So I think once we treat the anxiety and decrease the stress level that you're experiencing on a daily level, then we're definitely going to be able to treat your disorder. Okay. Thank you so much for coming in, and I'll see you back soon. All right. Take care now.